The National Network to Eliminate Disparities in Behavioral Health, or the NED, was created to connect and support community-based organizations that are doing exemplary work to address mental health and substance use issues in Indigenous and racially and ethnically diverse communities across the country. Since its inception, the NED has grown to over 1,000 organizations across the 50 states, U.S. territories, and Native American nations. In this video, we will share why and how state leaders and agencies can use the NED's Partner Central features to locate, connect, and engage with community-based partners. This will improve reach to underserved communities of color. State leaders and agencies receive federal and state funding to provide mental health and substance use disorder services. Unfortunately, trusted community-based organizations serving racial and ethnic minority populations often are not included in these funding opportunities, despite having behavioral health expertise and established trust within their communities. There are several reasons why state leaders and agencies are encouraged to partner with trusted local community-based organizations. First, partnering with CBOs provides a way for state leaders and agencies to identify gaps in needs and strengths within communities. CBOs can help engage community members in dialogue through state or jointly sponsored listening sessions or town halls. States can invite CBO leaders and community members to join state advisory boards or work groups to represent community voice. CBOs can help state leaders and agencies gain insight on how to engage and serve racially and ethnically diverse communities through existing behavioral health services. As trusted community providers, CBOs can shed light on the barriers that communities face in accessing services and offer effective strategies for outreach and engagement for specific racial and ethnic groups. Third, state leaders and agencies can invest in communities by elevating their strengths and expertise. The solutions often lie in community. Communities have often established networks of care that include formal and informal care providers. State leaders and agencies can also learn from communities the adaptation of evidence-based practices and promote the use of community-defined evidence, practices that communities have used and found to be useful over time. Finally, partnerships with CBOs can help to develop and support a robust, racially and ethnically diverse behavioral health workforce. State-sponsored behavioral health internships and mentorships with CBOs can create a pathway for youth and young adults of color to join the behavioral workforce. CBOs can also help identify untapped talent in communities of color for recruitment and training. Community health workers, peer specialists, and cultural brokers, such as promotoras, offer lived experience and expertise. Contracting or hiring these providers builds trust while also investing in the community's workforce and economic development. We know that finding and connecting with ethnic-specific community-based organizations can be a challenge. Now that we have outlined reasons to partner with your local community-based organizations, we invite you to join the National Network to Eliminate Disparities in Behavioral Health and access Partner Central to connect with these organizations. Thank you.